did an injection and it hurt really bad, and you told me that was good because you hit a spot that was important.
Right.
And for that, that's what really made a big difference, was getting that.
Hey everyone, Dr. West and Craig with just an amazing story. Craig hasn't been in the office for 2 years, and he said if I wasn't feeling so good, I would obviously have to be back. And we started talking about what it was like when he first came in, and I was like, we have to go and tell the story. So Craig, you came in scheduled for back surgery, but several years ago, right?
Yeah, several years ago.
And what was happening, and what were you doing at the time? Because it's just such a neat story to be a part of.
Well, my back, I was always going to chiropractors. It wouldn't stay in. Back was always out. I was always going back into the chiropractor and getting realigned, and it would work for a while, and then it would, and it got to the point where I'd really abused it, to the point where I actually went to different doctors and ended up going to a surgeon, and they said I needed surgery. The disc had deteriorated to the point where, they was going to have to go into pinching a nerve. Just miserable, a lot of pain.
And it was making it so you couldn't even function.
No, I couldn't. I was curled up in a ball, just pain, couldn't even hardly walk. Sitting down hurt, walking hurt. I mean, so I was at the point where I was ready to, and I was actually scheduled for like 2 weeks out for back surgery when a friend told me to come and talk to you guys down here.
Okay.
So.
And what do we do for you?
You looked at the MRI, you looked at pictures, and you said you thought you could help me, and let's try to get some injections, the prolozone injections. And I said, well, what if I got to lose? So we did some injections.
So everyone, we did a vitamin injection with some ozone, and then what happened?
It started feeling better.
Yeah. Did you have to get surgery?
No, didn't have surgery.
No
Thank
surgery.
Goodness.
And anyway, it was a really neat experience because you were able to keep your out-of-body shop.
Yeah, well, and it's not easy. That's a hard way to make a living. People don't realize. And yeah, there's a lot of lifting and being a little guy and thinking I'm bigger doesn't work either. But
and then after that, we had a shoulder episode. So tell everybody what that was.
Well, I fell on this shoulder. I fell on the ice really hard, just slipped and fell, and I landed hard, and I couldn't even use this arm. I mean, I couldn't even lift my arm, and then I thought I had faith that you could fix that shoulder, and I remember coming in one time and you did an injection and it hurt really bad, and you told me that was good because you hit a spot that was important,
right?
And you were right, because right after that, that's what really made a big difference, was getting that.
Okay,
but now.
Right. So. We're able to avoid a back surgery.
Yeah, good.
Avoid a shoulder surgery. It's been 2 years since you've been in. Feeling pretty good. Just a little bit of maintenance work. We're doing a new spot today, or what's the same?
Lower back. Just
okay.
That's a little tune-up, I guess.
A little tune-up. So pretty cool that we've gone 2 years between treatments. And if there's anybody out there watching, Craig, what would you tell them?
Believe me if I tell you to come and talk to Jason. I tell people, and they just look at me like, oh, you don't know what you're talking about. They get confused between a cortisone shot. A lot of people think it's a cortisone shot. That's not what it is. They don't work. They didn't work for me.
So the difference between cortisone, it's an anti-inflammatory, and the prolozone procedure is proliferative therapy using ozone. So it makes the body go into healing mode. It's 180 degrees opposite of cortisone. Craig, is it okay to put on social media?
Sure.
Okay, so we're gonna finish up. Really cool story, helping avoid a back surgery, a shoulder surgery. Now we just do a little maintenance work. Just a really special case to be a part of. This is Dr. West and Craig signing out.